We veterinarians had heard about some type of outbreak in the Chicago area, and we knew that dozens to hundreds of dogs were becoming sick.
We would treat them for kennel cough with doxycycline typically, but 48 hours later, 24 hours later, they were sicker. They were feverish, coughing, inappetent, and some of them developed very rapid pneumonia.
Some people thought, well, these dogs have not been vaccinated for influenza, so of course they're going to get this virus that they're not protected for, and they're going to get very sick. And some people thought, gosh, maybe we do have something new here.
When it was discovered that there was a new strain of dog flu, which was called H3N2, first of all I said, what? I mean, who ever heard of a dog flu from Southeast Asia?
Vets were somewhat panicked because A, there's no vaccine for it. B, the virus had never been reported in North America before, so that was scary.
We were all kind of learning literally on the fly. I was working with people at Cornell, working with people at the USDA, working with my Merck rep and my Merck technical service veterinarian very closely almost every day, just trying to piece together everything that we knew and communicating, kind of real time. Now we found it's a new virus. Now we find that the shedding is different. Now we find that the signs in the patient are different.
We knew it was bad, and we knew that he was very sick, but he had no symptoms, and all of a sudden he had symptoms, and within hours he, was in the hospital for 5 days in intensive care.
The cases first started to trickle in, 1 or 2. We started to notice the trend, and then it was 4 and 5 and 6. At the peak, we were seeing somewhere between 10 and 15 cases a day.
We were anywhere from 750 to 1,000 cases. A lot of our numbers really slowed down once we got a handle on it and really could educate the public and our clients.
In order to be able to prevent disease outbreaks like this is to be able to work with the community, so we educate them on what signs to look for, and that dogs ideally avoid those classes or those boarding facilities during any type of outbreak.